point out over medicating can cause resistance. Say, for example, a patient is infected and they take every antibiotic they can think of. The virus can eventually build up a resistance against those drugs and become a stronger infection or a stronger virus, and could cause greater complications with whomever that patient 1 or patient 0 interacts with, because that patient might have built up a tolerance to the drug, and that patient might be over medicating, but the bacteria or the virus that is causing the infection, once that patient starts taking all these drugs, can also start building the strength or the resistance of the bacteria itself. And then once that patient is released asymptomatic and starts interacting with other patients or other people who have not been exposed, they could be at risk for greater complications. So let me just say right now, I think the best thing to do is focus on wearing your masks and keeping your distance, social distancing, washing your hands, and just avoiding all the opportunities that you could come across with contracting the COVID.
Well, what would you say to the person who wants to know what are the best over-the-counter opportunities or drugs to increase your immune system? Because I first always know, if I'm talking to a nutritionist, they would say it's all about your foods that you're eating first and foremost. What are common things that one can take after they, again, full disclosure, speak with your physician first, because even minerals and vitamins, too many of them can have a negative effect as well. Okay, so I want to make sure we're very clear. No one is telling you to go and go to the pharmacy tonight and go buy the whole shelf of zinc. What we're saying to you is make sure you follow up with your health professional first. But what are some common things that are immune boosting minerals and vitamins?
Vitamin C, for sure, and zinc are the two that I come straight to my mind. Actually, what's interesting is in March, when I had actually it was April, I had my telehealth visit with my doctor. She recommended zinc, so I was going to every pharmacy to find some zinc on my own. And like you said, people are taking.
The pharmacists couldn't find zinc.
The pharmacists couldn't find the medication. Right, exactly. And because those are the two that come to mind. So if you can't find it, I would just say focus on.
And what are the normal recommended doses on a normal basis of zinc supplements and vitamin C?
Great question. I do not know the actual numbers. I think zinc is 15 to 20 milligrams. I'm not sure about vitamin C. You just want to be careful though, because zinc, for example, don't take too much. If you just 15 milligrams, I know for sure because my doctor told me this. 15 milligrams.
But again, even the pharmacist is not self-medicating. You talk to your doctor who's intimately aware of what, Dr. Gilbreath's medical history and her condition is. And so she's able to then prescribe. Full disclosure, I know that I need more vitamin D, and I did the same thing. I contacted my physician to say, what's the dosing that I should be taking? And she did prescribe a specific dose for me to take. And so I think it's important for everyone to know, as with anything, please be very mindful and careful of just, hearing one or two blurbs out there. Oh, okay, let me go get hydroxychloroquine. Or, zinc. Okay, let me go and get zinc. Oh, I heard vitamin C. Let me go and get that. Still talk to your doctor. These, again, are just common normal things for normal immune boosting opportunities. And so everyone, again, please use those telehealth visits and follow with your physician.
Let me share my screen one more time.
Sure.
I got these slides from the World Health Organization. They're Mythbusters. So if you Google WHO.
I think it's WHO.int.
Right, international, right?
Mm-hmm.
But let me share my screen. This is another one just for giggles here. Do not, under any circumstances, try and take bleach or anything like that.
Who would have ever thought in 2020, somebody had to produce a slide that says, do not under any circumstance spray or introduce bleach or any other disinfectant into your body. Why? Because some person made one little comment, unfortunately, and those individuals that don't have the knowledge of healthcare, you rightfully so will trust that leader. And so it's important, again, do not do any of these things without consulting your health professional. This is wild.
Yep. So I just want to make sure you got to see that. And I've also gotten some text messages directly from friends of mine asking about iodine. And no, just no. Just no, unless you talk to your physician. And let me share my screen one more time. The reason they asked me about this is the question about radiation and does 5G.
I heard about that too. Mm-hmm.
Yeah, so someone literally asked me about where can I get iodine, and I was just like, "What are you getting it for?" Well, I'm not sure. And like they're trying to talk around it because they already know. Again, we know better. Like your grandmother said, you know better. Trust you just know better. So this is the slide. Essentially, 5G does not spread COVID, so just disregard that. The only way it can be spread is through coughs, sneezes, speaks, any kind of respiratory breathing in someone's face, and it can be, or from touching your eyes, mouth, or nose. So that was that.
So Cheryl, in closing, what, as we end, what's your final message to the folks that are watching us tonight?
The same thing you've been saying, stay home if you can. Wear a mask at all times. Get your fresh air though. Exercise. Boost your immune system the natural way by eating healthy and exercising and drinking lots of water. Oh, that was another thing. Drink more water than you usually do. That helps boost your immune system. And
also for patients that are COVID positive, well, let me rephrase that. For typical persons, when you have respiratory symptoms, hopefully, and I know this from experience, is sometimes that when you're staying hydrated, you want to always be cautious of having pulmonary edema, meaning where the fluid builds up in your lung. But if you are a very well hydrated individual, even like when you have a common cold or the common flu, the more fluids that you intake, the mucus that you produce is thinner. So it's not thick, copious. It tends to be a much thinner, so you kind of have more of a run of your nose versus that thick stuff that blocks up your nasal passages. And so that's why you will often hear during the wintertime for people to say, drink lots of fluid, drink Gatorade, make sure you keep your electrolytes up. But you just reminded me when you said that again about staying very well hydrated. That's a very, very key point.
Yeah, very good. And do not take any medications unless your healthcare provider has prescribed them to you, specifically hydroxychloroquine. And I know one of the comments said that some people are getting the prescriptions from their physicians. Hopefully it's for very good reason, and hopefully those physicians are actually reviewing the patient's healthcare history or drug history, because hydroxychloroquine has several drug interactions and severe adverse reactions that could cause anything from blindness to heart failure to death. So this is a dangerous drug. You don't want to play with it.
And again, for those of you watching, please just go to the FDA.gov, type in the name of the drug, not just hydroxychloroquine, but any drug, and it will give you a list of all of the approved indications and side effects. And so again, you don't have to listen to Dr. Gilbreth or myself. Make the best choice for you and your family. And we pray and hope that you make a wise choice that continues to positively impact your health. Just please don't take hydroxychloroquine. We need that medication for those individuals who have it for a prescribed reason, and we don't want you to have the most negative outcome, which can be death. Second to that, I would say, is blindness. We don't want that to happen because of a 30-second soundbite. I hope and pray that poison control will not have black market overdoses of hydroxychloroquine now. And I really hope that the physicians and NPs that have access to DEA licenses that are writing prescriptions will not succumb to the fiscal desire to increase their pockets while prescribing medications. I have no real rationale as to why our leader would take a medication, particularly at his age and health. Particularly the older you get, there is something that also impacts the efficacy and safety of a drug, which is the time that it takes for your body to process it, and your body has to metabolize it. And the older you are, your body's ability to metabolize a drug decreases. And that's just by natural progression. Just like if you have a car that's 20 years old, it's not going to go from 0 to 60 as it was when you first got it. And the more weight that you have on yourself is also another issue as well. If you are more obese and you have more adipose tissue and fat cells, that can also hold on to the metabolites, which are the excess outcomes of the medications once you take it, once the drug has been metabolized. And I would really hope and pray that, he isn't harmed by, taking a medication that has a very, very negative outcome. And so hopefully that messaging, I hope and pray that that does not happen to people because, again, of a 30-second soundbite. Yeah, I take hydroxychloroquine, I've been taking it for the last few weeks. But why? Are you positive? Like, why would you take that medication? Cheryl, I told somebody, I had them laughing yesterday. I said, taking chemotherapy agents also often causes weight loss. Well, if you need to lose 100 pounds, do you really want to go and take chemotherapy drugs? No, even though that's in your eyes a positive outcome, it's horrible to get, you don't want to lose weight by taking a drug that's unnecessary. But what we do know as healthcare practitioners, what is normal for the normal citizen is that hydroxychloroquine has serious side effects. Do not take it. Do not ask for it unless you are in a controlled environment. And specifically, that means in a hospital setting, because again, it is not approved for COVID patients. Period. It is still in an investigative stage. So in my closing, I just want to continue to remind people, stay well informed, fact check for yourself, continue to make sure that you know what's going on in your local jurisdictions. If you are here in the DMV area, it's very, very simple, particularly in DC, go to coronavirus.dc.gov. And also please make sure that you just go to the cdc.gov website and click on the state. There's a map. If you click on the state, it will take you directly to your local state's health website, and you will be able to get that information. Cheryl, in DC, the information goes straight down to what neighborhood. It will tell you what neighborhood has the most infections. And so thank you, Dr. Gilbreth, for being on tonight. Hopefully we will do this again. For those of you that are watching, please share. Go to the FDA.gov is the website that Dr. Gilbreth referenced, where you can find out all the information for not actually hydroxychloroquine, but for all drugs. And you can type that in and find it out. As I've always said, be well, stay well. Please continue to stay at home. Please continue to wear your face mask. And both Cheryl and I are both women of faith, and there is still Christ over COVID. There is still a peace over this pandemic, and there is still faith that we should continue to exude over fear. Let's not buy into the hysteria. Let's continue to be practical during this pandemic. Please do your best. Wash your hands. I know it's difficult. Protect your mind. Read, journal. Start that business, start that website, use this as productive time if you are still working at home. My prayers are definitely for those that might have been impacted from the economical impact of this and the fiscal impact of this. We know it's not easy. My prayers are for those that are still in abusive situations right now. Those of us who, I yearn to be back in church. I yearn to be back, praising God and worshiping in a normal setting. It's not normal for me just to be looking at a TV or a computer screen every Sunday. And Cheryl's also a singer and a leader, and it's just difficult. And so we both had a friend that passed away about 2 weeks ago, and Cheryl participated in his funeral on Zoom. It was just a very, very uneasy situation. My own grandmother who passed away that I won't be able to go. So my prayers are for all of us, and however this pandemic is impacting us, just do your best and know that we are alone together, and take advantage of technology to continue to forge forward. And prayerfully together, we will see what the end of this curve looks like, and we will see prayerfully what the end will be, as they say, when this pandemic is over.